I'm Dr. Jordan Lee, and I'm a pulmonary and critical care doctor working in the ICU at Queens Medical Center in Honolulu, Hawaii. Right now, our ICU is at capacity with COVID-19 patients. I want everyone to know the suffering is real. And COVID-19 is like nothing else I have ever seen before personally, not in just the way that it presents itself to our patients, but in many other aspects. As a native Hawaiian, I became a doctor to better the conditions of our people, and right now, this virus is ravaging our Pacific Islander communities. The saddest thing about this disease is that you have to suffer through it alone. It's changed the way we practice, it's changed the way we interact with people. So patients are boarded up in their rooms, total isolation, no visitors, no family presence. Unlike other viruses and other conditions, most people stay in the hospital for an average of 3 to 5 days. But what we're seeing with the coronavirus is that they stay longer, anywhere from about 10 to 12, even 14 days. Some of our sickest patients have been in the hospital for about 2 months. We are concerned that if the COVID pandemic is out of control, that the hospital systems will not be able to take care of all these patients who are going to be coming in around the same time. Most of the patients, when they come to the ICU, are so sick that they require life support. So at that point, we put them on ventilators, we sedate them. A lot of the times, because their lungs are so stiff or non-compliant, they have to undergo paralyzation. So they're paralyzed, they're prone, which means we turn them on their bellies for a few hours a day, flip them back. It's a very traumatizing experience, and I would hate for anyone to have to go through that experience alone. One of the hardest experiences that I had was actually telling a family member, their loved ones, that this patient was going to die from COVID pneumonia. So the body had shut down. They were on maximal amount of life support, but they were still not doing well. And so normally we have face-to-face family conferences. We have the ability to be bedside with them and kind of walk them through our process and comfort them, hold their hands. That's all gone. And that's probably the hardest thing to see, is when patients are here and they're dying, that they're dying all alone. Having empathy and connecting with someone to comfort them in their final stages of life, I think it's so hard to do that with the patient not being able to see you and hold your hand. All they can see is a window into our eyes, because that's all they see when they go. So it's really hard.